The best candidates for dental implants are patients that are missing teeth, because we know that once they come into the office, into our practice, we can deliver a smile for them. We can get them back to chewing their food, taking selfies, whatever they do on a daily basis, where they're not inhibited by a missing tooth. When a patient comes in for a consult for an implant, planning is key, because we want to make sure that we can deliver the proper restoration and the right implant for that patient. So when the patient comes in, one of the first things that we do is we take a CT scan. So we take a 3D image, which allows us to see the bone, and allows us to see exactly where that implant's gonna go. And that's important because it allows us to make a guide so that we know exactly which spot in that patient's mouth where that implant is gonna go. When the patient comes back after the CT scan's taken, we're able to seat them in the chair, and we take a 3D scan, a different 3D scan. This scan is an impression that allows us to pair the CT scan with it to make a surgical guide, which shows us exactly, again, where that implant's gonna go. Once that's set, we bring the patient back, and the next visit is actually placing the implant. And after that, there's a couple other visits that we bring the patient back for, which allow us to check and to make sure that everything's healing and doing okay. And it's really smooth sailing after that point. Typical timeline for recovery from a dental implant from a discomfort perspective really it's minimal. I mean, maybe a day or so, and then patients rarely find that they need analgesics, pain relieving medication after that. Usually it takes several months or so to recover from having a dental implant in terms of the bone healing. Not that the patient is having any discomfort, but it takes some time for the implant to heal around the bone.